Do you know the game-changing, tiny, critical hip movement that can transform people's lives if they have knee, hip, or low back pain? I'm Joanne Elphinston, and I'd just like to share a little story from my clinic this week. And this patient, he's an athlete in a multi-directional sport, and he's had a big episode of low back pain. He has largely recovered from that, but he's come in and said, I'm struggling to get back to dynamic movement, and I can't land from a jump. I was trying to do some jumping with my kids, and I can't do it. So, what we saw with him is what we see in so many low back patients is that they freeze around the torso, but they also immobilize the hip. So, when it comes to jumping, we need hip, knee, ankle coordinated motion. What we see is people who have knee and no hip, or we have going posteriorly, but we don't have the spring here. What we need to do that is something called a vertical hip release. Now, we need that to shock absorb in any way if we're running, if we're walking down a hill, if we want to change direction. It's all the same. So the movement that we need here is, well, can we bend the hip? And you will find with your patients and your clients, very few people can. Then, where's your sitting bone? And now, can you carry yourself down towards the floor with the trunk vertical? This is what makes me springy, yeah? So I'm not here, and I'm not here. This is where I open the capacity for sagittal plane movement. Of course, if you're going to greater depth, you will see a shift in the orientation of what happens in the pelvis relative to the shoulder. But there's so much movement that we do that doesn't require that kind of depth, and that needs this little vertical hip release. Okay, so check it out with your patients. It'll be quite interesting, and this is all about force sharing the force across a large number of joints so that we don't amplify force in any one place. If you'd like to know more about this way of thinking, then please do join us. Check us out on gemsmovement.com. Bye for now.